I'm sorry you've been diagnosed with prostate cancer, but you've come to a great place at Penn Medicine and Penn Urology for an opinion regarding your disease and your treatment. In this short video, we're going to review some of the prostate cancer basics in preparation for your consultation in clinic. So first, prostate cancer is the most common male cancer. Over 250,000 men each year will be diagnosed with prostate cancer in the United States. Unfortunately, about 35,000 of those men will actually die of prostate cancer. That's just over 10% of the men diagnosed. Fortunately, that means about 90% of men will survive their disease. Those numbers may not mean a lot to you, so we're going to put it in a slightly different context. 1 out of every 8 men in the United States is diagnosed with prostate cancer. As we said before, about 90% of those men will survive of the disease. So there are 31 million prostate cancer survivors out there around you. So whether you know it or not, you know a prostate cancer survivor. They may be in your family, in your work, in your neighborhood, in your church. So there are lots of men and lots of families affected by this disease. You are not alone. In general, prostate cancer is broken down into what we call risk categories. And there are 3 general risk categories, what we call low, intermediate, or high risk disease. These refer to a number of things, but importantly, they refer to the risk of prostate cancer spreading from the gland. They refer to the risk of you dying of prostate cancer. They help us determine if you need additional tests like a bone scan or a CT or an MRI to see if prostate cancer could be anywhere else in your body. And lastly, they help us make treatment decisions. These risk categories are based on 3 important clinical characteristics. First, what was your PSA when you were diagnosed with prostate cancer? In general, the lower a PSA, the lower the risk of prostate cancer and the lower the risk of aggressive prostate cancer. The higher a PSA, the higher the risk of having prostate cancer and the higher risk of having a more aggressive cancer. The cutoffs for intermediate and high-risk prostate cancer start at 10 and 20. So most men with a PSA under 10 are in the low risk category. The rectal exam also helps us determine risk. That determines something called the clinical stage, or how we feel that the prostate cancer may be affecting or growing outside of the prostate gland. Chances are, if your doctor, whether it's a primary care or a urologist, did not feel any lumps, bumps, or anything scary on your prostate, you're in the low risk category. And lastly, and most important, is what's called the Gleason score. This refers to what the prostate cancer looks like under the microscope and really determines its biological aggressiveness. Now, in general, the Gleason system goes from 2 through 10. And in this schematic, you can see, even just looking under the microscope, as a prostate cancer climbs up the Gleason scoring system, the more aggressive and abnormal those cells look like under the microscope. You don't need to know the details of the biology or what it looks like under the microscope, but how we categorize Gleason score is really important to understanding your disease and how we make your treatment choices. In general, Gleason 6 is what we call low-risk prostate cancer. This is also referred to as grade group 1 disease. These are low-risk prostate cancers. They're generally bland looking under the microscope. They're not aggressive, and they have very limited ability to spread from the prostate, to spread around the body, or to kill you. Intermediate risk prostate cancers are Gleason 3 plus 4 or 4 plus 3 equals 7. This refers to the fact that they have a little bit of that pattern 4 or aggressive prostate cancer. And lastly, we have high-risk prostate cancers. These are Gleason scores 8s, 9s, and 10s, where all we're seeing under the microscope are aggressive cancers. Now, for men with low-risk disease, recognizing that these cancers have a very low ability to get out of the prostate, we will most often focus our discussions on active surveillance or watching this cancer. Very few men, in fact, no men, will die of low-risk prostate cancer. And the reason we follow men closely is for their risk of developing another cancer throughout their life. Men with intermediate risk disease have highly curable cancer, but this cancer often requires treatment. So we will discuss things like surgery or radiation as your primary management strategies. And lastly, men with high-risk prostate cancer will often require more than one treatment to get to cure or control of this aggressive form of prostate cancer. I hope you found that helpful.